Hello, I'm going to be doing my project on loop diuretics. So let's get started. Okay. Okay, so loop diuretics inhibit reabsorption of water, sodium, and chloride from the loop of Henle and distal renal tubule. They work to increase renal excretion of water, sodium, chloride, magnesium, potassium, and calcium. Therapeutic class and indications. They're used to diurese, to get rid of fluid, causing mobilization of excess fluid. It's effective even with impaired renal function, which is a good plus because a lot of patients that have CHF can also have some degree of declining renal function. It's used for acute exacerbations of heart failure with almost immediate water loss when given intravenously with an onset of 5 minutes. It's also used for acute pulmonary edema and short-term management of hypertension. All of these comorbidities are usually related to one another. The diuretic effect also increases with increased dose. They're a pregnancy risk category C. Category C medications are known to show adverse effects in the fetus in animal studies, but no adequate studies are available in humans. This category indicates that benefits of use with this drug in pregnant women may be acceptable despite its potential risks, and use during pregnancy should be reserved only when the mother has pathological reasons for use and the benefits to the mother clearly outweigh the risks to the fetus. Okay, so how loop diuretics work. So this is a nephron of a kidney. Water and electrolytes are filtrated into the nephron, goes into the descending loop of Henle, and as it goes into the medulla of the kidney, it gets more concentrated. And normally, water flows out through osmosis and gets reabsorbed back into the bloodstream. So what loop diuretics do is they block the chloride pump of the nephron, and the water does not get reabsorbed back into the bloodstream and ends up getting eliminated through the ureters, eliminated through the kidneys, and then through the bladder and excreted from the body. Okay, so 30% of filtered sodium is normally reabsorbed back into the bloodstream, like I said, and through the nephron's ascending loop of Henle. Water, sodium, and chloride diffuse back into circulation through osmosis, and loop diuretics block that pump in the ascending loop of Henle, causing rapid loss of water and sodium. So this is just a little diagram of the chloride pump and how it works. This is the nephron, the lumen of the nephron, and water stays trapped inside of here, does not go back into the circulation and gets excreted out of the body, so that the treatment is to get rid of excess fluid in the body. So physiology and therapeutic uses of diseases treated by loop diuretics. Okay, so diuretics are used in acute exacerbation of heart failure, pulmonary edema, and hypertension associated with fluid overload. So some pathophysiology of the heart. So basically, acute decompensated heart failure occurs most commonly with the left ventricular failure, secondary to coronary artery disease. Also, sclerosis of the arteries can cause increased afterload, which is also known as blood pressure. Basically, it's the resistance that the left ventricle has to pump against to get oxygenated blood to the rest of the body. Constant strain on the left ventricle causes hypertrophy or enlargement of the heart, the left side specifically, and weakening of the heart muscles pumping ability. So basically, the heart is weakened. It has to manage and deal with all this fluid, and it's too much for the diseased heart to deal with. Damaged heart's not able to circulate the fluid normally. Stagnant blood eventually starts to back up. Blood flow backs up from the left ventricle to the lungs, and then that's when you would hear the crackles in the lungs, and then to the right side of the heart, and eventually into the tissues and organs. So that's when you would get some of the edema, some of the visceral pain from cardiomegaly or from splenomegaly, and all of the organs being saturated with fluids, maybe a feeling of fullness. So nephrons in the kidneys are responsible for selectively filtering water and electrolytes in and out of the body. Loop diuretics alter the filtration process by blocking the chloride pump in the ascending loop of Henle. By blocking the pump, water and sodium are filtered out of circulation, decreasing the body's total volume, and the damaged heart is now able to temporarily manage the amount of fluid circulating in the body. So this is how they work to help in this pathology of heart failure. Okay, so here's an overview of the circulation of blood in the body. So with the left ventricle is usually where it starts. This whole area of the aorta is usually stenosed and sclerotic, causing the heart to have to pump up against a very, very narrow vessel. This side of the heart works really, really hard, starts getting enlarged, and when it gets enlarged, it doesn't really function properly as a pump. So fluid starts to back up here, kind of hangs out in here, eventually starts backing up into the lungs, and that's where you're going to hear the fluid and the crackles. And when it backs up even more, it goes into the right side of the heart, eventually into systemic circulation. That's when you start getting the peripheral edema. So that's an overview of the circulation of the heart and the pathology of heart failure. Nursing management interventions include, when somebody's taking this medication, therapeutic goals is to maintain fluid balance along with balancing electrolytes such as potassium, sodium, chloride, magnesium, calcium, because it also excretes a lot of potassium, calcium, magnesium, and chloride. So you can have some imbalances if you're not watching the amount of potassium in your body. They should keep in mind that loop diuretics are used in acute exacerbation and are only used as adjunct therapy with other medications. So if they're not being compliant with their medications, such as beta blockers, ACE inhibitors, they're going to have these acute exacerbations, and they're going to need to take loop diuretics, to help out with the exacerbation. But if they would take that in combination with their other medications, they may not have these acute episodes. So long-term management includes ACE inhibitors, beta blockers, calcium channel blockers, and longer acting type of diuretics like thiazide diuretics. All right. So other management strategies include putting them on a fluid restriction of 1.5 to 2 liters a day. If you're going to be getting rid of all that fluid, it doesn't make any sense to keep putting it in your body by drinking too much liquid. So another restriction would be a 2-gram sodium diet, because where sodium goes, water follows. So you're going to have more retention if you eat a lot of salty foods. Daily weight should be recorded to measure the amount of fluid of the body, and weigh at the same time of day and the same amount of clothing is what you would instruct your patient to do. You want to monitor the electrolytes, especially potassium, which can cause serious alterations in cardiac function when out of balance, and monitor for hypotension. Take the blood pressure before administering to avoid dangerous drops in blood pressure. This can also include a risk for falls, because you will get hypotensive. They'll get hypotensive taking these medications, maybe dizzy, maybe they're in a hurry to get to the restroom because they have to pee a lot. So you want to always instruct the patient to dangle at the edge of the bed before they get up, to avoid the risk for falls. Change position slowly to avoid the signs and symptoms of hypotension like dizziness or lightheadedness. Like I said, sit on the edge of the bed before ambulating to the restroom to avoid falls. Avoid other over-the-counter drugs. When using them, you should always consult your healthcare provider first. When used with other hypotensive agents, these medications, Lasix can also decrease lithium excretion, leading to lithium toxicity. So they're taking lithium as well. They should be aware of that. Decrease effectiveness of loop diuretics when used with NSAIDs. So if they want to start taking aspirin and stuff like that, it could decrease the effect of loop diuretics. And also, loop diuretics cause increased risk for digoxin toxicity in the presence of hypokalemia. If you remember, Lasix gets rid of potassium. There's a risk for hypokalemia, which is not a good thing. And then also, if they're also taking digoxin, which many people who have heart failure are, based on, it's another modality of treatment, then they can be at risk for digoxin toxicity. Okay. According to a recent study, combined use of digoxin with any diuretics was significantly associated with a more than threefold increased risk of hospitalization for digoxin intoxication. Regarding this class of diuretics prescribed, the greatest was loop diuretics. So yes, it's very high risk for digoxin toxicity, definitely something to keep an eye on if taking loop diuretics. Okay, some cultural considerations. Urinary urgency caused by loop diuretics can lead to incontinence. Incontinence in American culture carries social stigma. The use of diapers for incontinence can be considered humiliating and lead to decreased compliance with the medication. Interrupted sleep for having to urinate frequently during the night can also disrupt the quality of life for someone taking loop diuretics. Okay, some cultural research includes up to 50% of heart failure patients suffer with lower urinary tract symptoms. Urinary frequency, urgency, and incontinence are extremely bothersome, with nocturnal symptoms that may disrupt sleep and quality of life. Healthcare practitioners should be aware that these medications used to treat heart failure may indirectly provoke or exacerbate urinary symptoms, and that tapering diuretics and switching ACE inhibitors switching for ACE inhibitors or ARBs are reasonable management approaches. So again, loop diuretics is used as adjunct therapy, not solo therapy. Okay, so another study that addresses herbal and alternative therapies included research that found in experimental research in mice. High amounts of aqueous extract of dandelion leaf has been shown to have diuretic activity comparable to furosemide. Since dandelion is a rich source of potassium as well, some researchers think that it's capable of replacing the potassium lost through diuresis. So a natural way to get rid of fluid and also maintain your potassium levels. Very interesting. Okay, so additional research done about loop diuretics. Diuretic therapy should always be co-administered with ACE inhibitors or ARBs and beta blockers if tolerated. Loop diuretics are usually the agents of choice in heart failure because they have a high ceiling diuretic effect and the ability to work in renal impairment. The common practice is to initiate diuretic therapy at lower doses and increase the dose as needed to reduce fluid retention as long as renal function does not deteriorate significantly. Okay, so let's review this again. Just a little bit of a recap. Loop diuretics act on the ascending loop of Henle in the kidney to prevent water reabsorption and diuresis of excess fluid. It works very rapidly to treat signs and symptoms of acute decompensated heart failure, such as pulmonary and vascular edema. Reducing demands on the already weakened heart muscle allows for other drugs to take effect, such as ACE inhibitors, beta blockers, and calcium channel blockers. Other important nursing considerations include monitoring patients' oral intake of fluid, salt, and potassium while addressing blood pressure prior to administration and recording daily weights. So there you have it. That's my presentation on loop diuretics. Here are my references. And let's go ahead and go over my pamphlet that I made. Okay, loop diuretics, information that you need to know. All right, so I included drug actions and potential side effects. Loop diuretics act on the kidneys to filter water, sodium, potassium, and other electrolytes out of the body and into the urine. This allows the body to get rid of extra fluid, so that can cause congestion in lungs and tissues, causing swelling and making it hard to breathe. Okay. Harmful side effects include low potassium levels, dehydration, low blood pressure, and deficiencies in other electrolytes. Also includes drug and food interactions. You want to consult your healthcare provider before taking any over-the-counter medications, such as ibuprofen, aspirin, or NSAIDs, because they may decrease the diuretic effect. Digoxin toxicity is a concern when taking these drugs concurrently, as decreased potassium associated with loop diuretics can increase digoxin levels. You want to avoid foods with high levels of sodium, such as processed foods, canned soups, and potato chips. They can cause water retention and decreasing the diuretic effect. And consume potassium-rich foods such as bananas, orange juice, and raisins to help replace the potassium losses. Okay, some instructions on how these drugs are taken. They can be swallowed as a pill, given as an injection, or into the muscle or IV. When swallowed as a pill, it usually takes 30 to 60 minutes for the drug to take effect, having its strongest effect in 1 to 2 hours, lasting as long as 8 hours. And when giving intravenously, the onset's usually within 5 minutes. Common dosing is 20 to 40 milligrams a day as a single dose, may be repeated 6 to 8 hours later. When used with other antihypertensive, the dose may be decreased by 50%. So that's the importance of taking it along with beta blockers or calcium channel blockers and the like. Make sure you're in an environment that you have access to restroom facilities. Avoid taking late at night so that you're not voiding all night long. And consult your healthcare provider. If you experience dry mouth, lethargy, weakness, hypertension, or oliguria, monitor for daily weight, swelling in extremities, and shortness of breath. Notify healthcare provider if you have weight gain of more than 3 pounds a day, increased shortness of breath, or swelling, as that's an indication of worsening of this condition. So there you have it, loop diuretics. I hope you enjoyed my presentation, and thank you.